What's up, guys? Welcome back to another episode of Braces Explained. I hope you guys have all been doing awesome, and if this is your first time on the channel, welcome. Make sure to hit the subscribe button in this corner so you can stay up to date with all things braces. So today what we're going to be talking about is how to whiten your teeth with braces, and whether you should do this while you're in treatment or after. To answer a lot of these questions, I'm going to be bringing on my friend Dr. Yazdan, who is a cosmetic dentist in Newport Beach, California. And she's an expert about all things whitening, veneers. She's great. So without further ado, I'm going to get our interview started. So let's go. So guys, I'm here with Dr. Yazdan, who is a cosmetic dentist from Newport Beach. And Dr. Yazdan, welcome.
Hi, thank you so much for having me. I'm so excited to do this interview with you.
Super excited to have you on here with us. Why don't you get started and tell us just a little bit about yourself so everyone gets to know you.
Okay, so like you said, my name is Dr. Desiree Yazdan. I'm a cosmetic dentist. I work in Newport Beach, and I guess I look forward to recreating and redesigning people's smiles on a daily basis.
That's so awesome. Yeah, and you do awesome work. For you guys that haven't checked out her Instagram, you definitely should. The handle is right here on the screen. So, Dr. Yazdan, I get a bunch of questions speaking about cosmetics for my patients about teeth whitening. And I wanted to get your stance on the issue. Do you recommend teeth whitening while a patient's under braces or Invisalign, or do you recommend they wait till after or before?
So, well, you can always do it before, but then you're going to cover your teeth with the braces, with the brackets. So
Right.
I would recommend waiting until after, because when you wait till after the procedure, I mean, if you did it while you were doing braces, then the brackets cover part of your teeth. It's hard with the wires and everything. So I would wait until after you're done with braces to whiten your teeth.
So with Invisalign, you don't have braces on every tooth or an attachment on every tooth. Is that okay to use whitening with, or would you still recommend to wait until the very end of treatment?
So that's kind of like a double-edged sword. So the bleach that I have in my office, it claims that it can actually go through the attachments and whiten your teeth. So if you're using, so I would feel comfortable in my office bleaching somebody who has Invisalign, as long as they don't have like so many attachments. You know, there's different treatment plans where some people have some, maybe like one over here and like two over here. I think that's okay. But if you had on every single tooth a bunch of attachments, I'd likely wait. With that said, you can do it, but and another thing patients do is they'll put bleach in their actual Invisalign tray. So the Invisalign trays are really tight on your teeth and there's no extra room. So what happens is if you put bleach on them, it'll get pushed up and out of the tray and kind of go by your gums. And it can cause your gums to burn a little bit. So I would usually wait until the treatment's done. Unless you're really self-conscious about it, then go ahead and do the whitening. Make sure you do it inside a dental office. And just know that when the attachments are removed, you may want to whiten your teeth again.
That's a good point. And then a lot of people ask, okay, could I use whitening toothpaste? Will that help? Or would you recommend people use whitening toothpastes while they're in braces?
You know, you can use whitening toothpaste, although when you have braces, you're building up so much plaque around the brackets and it's harder to keep your teeth clean. So I'd probably recommend using a toothpaste with fluoride in them. And a lot of whitening toothpaste don't have that high of a that much fluoride in it. So I'd probably recommend more of a fluoridated toothpaste, especially when you have braces on. You can use a whitening toothpaste. It's not going to be as effective as, let's say, an in-office whitening treatment. But I mean, if it makes you feel better, you might get some effect out of it.
That's a good point. And a lot of people ask, this whole craze, do you think that charcoal toothpastes actually work at whitening teeth, or do you stay away from them?
Okay, so stay away from charcoal toothpaste. I actually have like a video and a blog post on this. So social media tactics like these toothpaste and stuff that they're making and selling and claiming they do all this stuff, they're not regulated by the ADA, so you don't know the long-term effects of them. The other toothpaste that have been on the market sold by like reliable companies, there's been studies done on them. Activated charcoal toothpaste, there's been no studies done on it. You don't know, and actually it could be pretty abrasive and it could damage your enamel. It can cause damage to your gums, and the damage I'm talking about is irreversible. So if it does damage your enamel and your gums, you can't get it back. So I would not risk it. If you are trying to whiten your teeth, just do it the right way. Tell your dentist, let them know that you want to whiten your teeth, either opt for an in-office whitening session or buy a toothpaste by a well-known brand that's done the studies and is safe and actually effective.
That's a really good point. So that actually is a perfect segue to one of the other questions I had for you, and that is, once you decide to get started with teeth whitening, do you recommend the trays, the white strips, the in-office whitening? What do you see as the best product for that?
Okay, so the best product is to do it inside a dental office. So these are the reasons why. One, we can isolate your tissue so you reduce the chance of actually burning your gums, which can happen with the bleaching gels. Two is we use a prescription strength bleach. So it's a much more concentrated strength, which will give you better results. And then three, because your tissues are isolated and because everything's isolated, the bleach isn't actually getting contaminated with saliva or anything, so you get better results. And then when you use, like, let's say trays to take home, those are good because they're custom made for you, but you do get a little contamination of the bleach. It's also a lower strength of bleach that you're getting to take home. You can't use that high prescription strength bleach that we use at the dental office, but it'll still be effective. The other thing about that is whenever you bleach your teeth, you should stay away from staining foods like coffee, tea, red wine, anything that's really staining, soy sauce, anything that stains your teeth, stay away from. So if you do an in-office treatment, we say stay away from it for 2 days, so 48 hours. When you do it at home, to see results from, let's say, bleach trays or something, you typically need to do it for, let's say, a week or 2 weeks. So if you're doing it for 7 days, you have to stay away from all those things for 9 days.
Oh, wow,
so
okay.
It can be a little bit annoying, but it'll still be effective. The other thing is the bleach trays at home, like I said, they can get, like, your saliva can contaminate the bleach a little bit, which means it'll be less effective. And then on top of that, just the prescription strength bleach is not the same as, it's not the same as the dental office. With whitening strips that you get over the counter, you actually don't really know what you're buying. You're buying anywhere between 1% to 5% hydrogen peroxide. That's nothing. And you don't know if you're getting 1% or 5%. So although they could work for you, it would take a lot longer to see results. And I wouldn't really recommend it. When you take home, like, let's say I give a patient bleach to take home with a tray, a custom made tray, it's safer, and two, it would be 14% hydrogen peroxide. So that's a lot more than, let's say, the 1% to 5%.
Right, definitely. No, that's for sure. And then do you think, or do you know of any side effects of teeth whitening? Are there any downsides to it?
So the downsides would be the sensitivity, which can last up to 2 days after you're done bleaching. So that's it, though. If it's done correctly, then there should be no actual side effects. Like, it doesn't damage your teeth. It doesn't damage your enamel. It's really safe to do. It removes surface staining, so it's really safe.
So, Dr. Yazdan, I hear from a lot of patients that you get sensitivity when you have teeth whitening. Can you go over some of the ways that you can combat that sensitivity?
Okay, so everybody's different. So some people will bleach their teeth and it's like nothing happened, and some people will do 1 to 2 sessions of whitening and they'll feel like their teeth are just burning. So there's different things that you could do that can help prevent it. So one thing would be to use a fluoridated mouthwash and toothpaste 2 weeks before your treatment, and use it every day for 2 weeks. So every day you're getting consistent amounts of fluoride that you're being exposed to. So that'll help decrease the sensitivity. Once you have the treatment, there's certain products that I use to help patients who have sensitive teeth and are nervous about the sensitivity, and they do have fluoride in them, so that'll help during the procedure. And then also I have them tell me, if you just tell your dentist if you're sensitive or not, they'll be able to monitor the treatment for you and kind of modify it if you need it to be modified. And then afterwards, again, the fluoride and the toothpaste will really help, and a mouthwash with fluoride in it will really help. And then on top of that, I would stay away from anything that's really hot or really cold, anything that's really acidic, like, let's say, pineapples or oranges or something like that that's really acidic, because that'll make your teeth more sensitive.
So I see we have a little guest on the corner of the screen. I see a little bit of fuzz. You want to introduce our guest?
Sure. So this is Napoleon. I had to bring him on because he was just trying to play the whole time. And I figured, you know what, why he could just join me while we do this.
Awesome.
And you know what? A lot of people don't pay attention to their animals in the sense that they need oral hygiene just as much as we do. So you guys really, if you have cats at home or dogs, make sure that you're taking care of their teeth. Make sure you brush them. And yeah.
I think Napoleon agrees with that.
He sure does.
So thank you again so much, Dr. Yazdan. This was awesome. I'm sure everyone's going to really appreciate the things you had to say and share with us. And for you guys, if you have any questions or comments, you can leave them on this video, or I'm going to give you a link to Dr. Yazdan's channel, and you can leave the comments there as well. And make sure to check her out on Instagram as well as on YouTube. It's just some really awesome content for you guys. So thank you again.
Thank you for having me.
Of course, of course. Again, a big thank you to Dr. Yazdan for checking in on this channel. I had a great time interviewing with her, and she dropped some really useful tips that I hope that you guys enjoyed. If you have any questions to either me or to her, please leave them in the comments below, and make sure to check out her Instagram and YouTube channel because she posts some really cool stuff on there too. If you enjoyed this video, be sure to give it a thumbs up and hit the subscribe button so you can stay up to date with the content on this channel. I hope you guys enjoyed your time here today as much as I did. For now, Dr. Greg, out.